Mutations that might have caused cancer.
Washington University gynecologic oncologist and surgeon Dr. Andrea Hagemann treats cancer patients at Siteman Cancer Center in St. Louis. The fight against cancer is overall experiencing some success. Cancer death rates have fallen 33% since 1991, 32 years ago.
The cancer rates being down primarily reflect two things. Decreased smoking. So actually smoking cessation is very, very cancer preventive. We also know that HPV vaccine, or the human papillomavirus vaccine uptake, has also contributed to decreased cancer rates.
The HPV vaccine has been available in the U.S. for about 17 years.
Originally, this was implemented in girls, but our studies have now come to use boys and girls. And so since giving HPV vaccine to younger population, this has dramatically decreased the rates of cervical dysplasia, precancerous cells of the cervix, and cervical cancer.
It can help prevent other cancers too, in women and men.
HPV vaccine administered starting at age 11 for boys and girls protects against cancers that come from HPV. So that includes head and neck cancers, that includes anal cancers, that includes cervical cancers, vaginal and vulvar cancers. Knowing that a virus causes over 90% of cervical cancers and 90% of all the squamous cell cancers that we see and treat in the head and neck or anus or the vulva, aside from cervical cancer, that's a really causative thing, right? So if we can have a vaccine that prevents exposure and prevents HPV infection in people that kind of lies dormant, then it's so protective.
Dr. Hagemann says younger adults may also benefit from the vaccine if they were not previously vaccinated.
The one that's available today in the U.S. covers 9 strains of HPV. We do have some data that if you get it later in life, it still may be protective if you haven't been exposed to one of those strains. But it also, your immune system just doesn't take up this particular vaccine as well later in life. And so it isn't as effective the older we get.
She says another routine shot, the hepatitis B vaccination, is another one that can help battle cancer.
It's a vaccine against hepatitis being a cause of liver cancer. So we have a precedent of vaccinations helping to decrease liver cancers.
Cancer screenings for early detection, such as colonoscopies and mammograms, also contribute to the decline of cancer deaths.
We know that the earlier we find a cancer, the better we are at curing it.
Same goes for advancements in predictive screening tools to determine cancer risk.
We've had over the past 10 years is increased access to genetic testing to screen for mutations that are high risk for certain cancers, such as ovarian cancer. About 25% of them are caused by high risk hereditary mutations like the breast cancer gene and others that can lead to earlier onset cancer. And so if we can find those mutations before a cancer develops, we can do preventive things to help keep that cancer from coming.